If nebulization is used when a nitric sample line is integrated into the machine, there is a risk of the sample line filter blocked alarm being activated. To reduce the risk of this, micron filters are used as standard on the sample line inlet to reduce nebulized gas getting in the system and clogging up the sample line. When delivering nebulization, you are giving two gases at the same time. It could potentially dilute the nitric quantity you are delivering, and the sample line could potentially show a dip in the nitric dose during the neb period. The Animax machine draws 0.23 litres a minute into the sample line, so some of the nebulization drug won't be delivered. If the consultant who has requested nitric wants to continue with neb therapy and nebulization is regularly given, you will need to change the micron filter every 12 hours, or if the sample line blocked alarm occurs. They are available in the back of the machine. Disconnecting the disposables can lose PEEP, and this should be taken into account. When the water trap is full, the water separation cartridge will fill, and when this is full, the sample line can be damaged. Care should be taken to empty it if required. When it's taken off and you've emptied the fluid, you should make sure you have a secure connection. One step you could take is looking at the leak percentage before and after you've removed and replaced it to make sure it doesn't change. You could also look at the dose of nitric you're delivering, making sure it's unchanged. Using regular nebulization, you need to change the micron filter every 12 hours. A couple of spurs are kept in the back of the machine. Care should be taken to make sure all your connections are tight. It must be remembered that no protection or one-way valves exists, and if the sample line is disconnected, patients can lose PEEP, so this should be taken into account. There's an infrared sensor between the cylinder head and the main unit. If you put your hand over the cylinder head, you can see that the nitric cylinder will disappear. This is why you should never put your water circuit or Michelson C circuit over the top of the cylinder head, because after 1 hour, the machine will assume that the nitric isn't present and stop delivering it. The nitric should never be taken from a high level to completely off. It should be weaned, and the consultant who is prescribed therapy should advise how this is done. When you're happy to stop therapy, turn the dose down to 0. Set dose 0, closed cylinder valve will come up. You need to go to the back of the machine and turn the cylinder valve with you facing the back of the machine clockwise until it's completely closed. You can look at the cylinder icon. If it's not lit with green, then it's turned off. The sample line adapter and injector module will have to be removed from the patient's circuit before you can get rid of the machine. Does the ET tube need to be clamped before the disconnection is made? And do airway people and other staff need to be present? The filter and sample line are disposable and should be removed. Sample line adapter is also single patient use. The injector tubing is single patient use and should be disposed of with it being removed from the machine and the injector module. The injector module itself and the injector module lead are reusable and should be lightly cleaned with care taken not to get any fluid into the filament inside. The water separation cartridge that sits on top of the water trap is single patient use and should be disposed of. The water trap itself is reusable and shouldn't be disposed of, although it should be cleaned with Clinell wipes and dried at the end of the case and replaced. New disposables can be found in the B3 North ventilation room. These include filters, water separation cartridges, injector tubing, sample lines, and sample line adapters. You'll also find some patient labels for time and date in the new setup.